What are the long-term health effects of Fukushima? What are the long-term health effects of the Fukushima Daiichi nuclear disaster? This event, which occurred in March 2011, had significant implications for those involved and the surrounding communities. The disaster led to the releases of radioactive materials, raising concerns about health risks, particularly for emergency workers and residents in affected areas. First, let's talk about the physical health effects. The radiation exposure from the accident was relatively low for the general population. Quick evacuations and favorable wind conditions helped minimize exposure. However, emergency workers at the plant experienced higher radiation doses. This group faces an increased risk of developing cancers, such as leukemia and thyroid cancer. For the general public, especially infants and young children, there is a slight increase in lifetime cancer risk. Estimates suggest about a 1% increase for all cancers combined and around a 0.5% increase for thyroid cancer in female infants. Importantly, no significant rise in congenital disabilities or heritable genetic effects has been observed. Now, let's shift our focus to the psychological and social impacts. The evacuation and displacement caused by the disaster led to increased mortality among elderly individuals placed in temporary housing. Many evacuees reported higher rates of non-communicable diseases, such as diabetes. Mental health issues have also been significant. Post-traumatic stress disorder, depression, anxiety, and behavioral problems have been reported among evacuees, including children. The disruption of social networks and loss of homes and jobs contributed to these challenges. Mothers in the affected region showed higher rates of postpartum depression, highlighting the emotional toll of the disaster. When we consider high-risk professions, the Fukushima disaster serves as a case study. Emergency workers faced acute radiation exposure while managing the crisis. This mirrors the risks faced by storm chasers who monitor extreme weather or deep-sea fishermen navigating dangerous waters. The disaster highlights the need for protective measures and mental health support for those in high-risk jobs. In practical terms, ongoing health surveys and screenings are being conducted in Fukushima to detect any emerging health issues. The experience gained from this disaster informs safety protocols for nuclear workers and emergency responders worldwide. It emphasizes the need for preparedness, not only for physical hazards but also for the social and psychological aftermath of disasters. While the direct radiation-related health effects for most people affected by Fukushima are expected to be low, the broader health consequences include significant mental health challenges and increased risks for emergency workers. These outcomes reflected the complex dangers faced by those in high-risk professions connected to catastrophic events.